Dear viewers, it is our pleasure to have this interview with Dr. Samia Al-Amoudi. Assalamu alaikum, Dr. Samia.
Wa alaikum assalam wa barakatuh.
Dr. Samia Al-Amoudi, I would like to start this interview with asking you, how would you define breast cancer?
First of all, thank you for having me, and it's my pleasure. The breast cancer actually is a major health problem. It's an issue that that's important for every woman in the whole world. This is number one. Second thing, it's a very important issue because to a large extent there are ways for prevention and for early detection. And the early detection is the tool which is the best for prevention. When we explain what does it mean to have cancer in a simple way, usually our body consists of cells that divide regularly in orderly fashion. Sometimes for one reason or the other, something happens in the cells so that they will multiply and they will grow in without control. So instead of growing regularly, they will grow in a way which is not controlled, and they will start to form the swelling, which is called a mass or a tumor. Most of the tumors, most of the masses that we feel in the breast, or particularly in the breast, 95% they are benign. We call them benign because they are localized, they do not invade tissue, they do not travel outside the area.
I see.
Once they start to invade the other adjacent neighbor tissues or travel, then it goes with the terminology of malignant tumor or cancer. This is in a simple way.
What is the best treatment for breast cancer, Dr. Samia?
Actually, there is nothing best for everybody, and management and treatment depends on many factors: age of the patient, how far the tumor is spreading, the stage of the tumor. Usually there are three lines, major lines well known for treatment, which are the surgery, the chemotherapy, and the radiation. Not all the patient will need all the three lines, and not all the patient will have the same kind of surgery or same kind of chemotherapy. So it differs from one person to the other.
Are the treatment, Dr. Samia, free for both Saudi and non-Saudis?
This is a very good question. Actually, we are lucky to have the access for cancer treatment free in Saudi Arabia. And this is what is beautiful about it, because this is the equality in healthcare. Unfortunately, in other countries, it's not. And we know that cancer therapy is very costly. It costs a lot.
Exactly.
It's very expensive. But for the Saudi, it's free in the governmental hospitals. Of course, unless the patient chooses to go for a private sector. Mm-hmm. For the non-Saudi, until recently it wasn't, but now there is access for cancer patients to have the treatment in governmental hospital for free.
When is the best age, Dr. Samia, to check for this for breast cancer?
Good. Usually we advise the ladies and the girls to start to examine themselves at the age of 20, not because they are going to have or they are at risk, because we know cancer, usually it comes in old age, like 50s and above. But because we want the ladies and the women to increase the awareness on the tool of examining their breast.
Right.
So we advise the girls to have monthly examination from the age of 20, so that they could be familiar with the texture of their breast, and at the same time they could detect if there is any abnormality, although it's rare to have cancer at this age group.
To be more familiar from the beginning.
Exactly. So from age 20, every month we do workshop here to train the girls on how to do the breast self-examination.
I see.
This is from 20 until 40. From
see.
the age of 40, they are required to have the mammogram, which is the X-ray, special kind of X-ray, to detect early masses in the breast. This is the yearly checkup that we advise women to go for.